My name is Dr.Achol. I am Deputy Chair of HIV Commission.
Okay, yesterday I've been in meeting with CCM and they say in the report that there is increasing of HIV. So the data of HIV in South Sudan exactly is how?
You know, we have a problem in South Sudan. We are taking a data of antenatal. And you know, in South Sudan, most of women are in the rural areas. Who comes to the hospital to give delivery? Who comes to the hospital to follow up the pregnancy? They don't do it. So that data is not exactly correct. Okay? They say in South Sudan it's 2.4% this HIV. But the reality is not. Okay? You could see now in Yeru, in Bor, it is just wrapping up. Usually it happens when there is a problem in the country. The HIV increase because what do young people do? Is to sit and love each other. Okay. So if one is infected, it will infect the other, infect that. And then with the war, the services are not going everywhere. So we have a problem of service not going to the root, like boomers. The people who knows about HIV are the city people. Majority of South Sudanese are in the rural area. So we have a big problem.
What we must do to stop this dangerous called AIDS?
Now there is one thing. You cannot put the health of your own people in the hand of organization. Now organizations are not funding prevention. So, and prevention is the key. And the government has to fund prevention. So funding for HIV Commission is very low. We need HIV to be funded well, and we need to go to the root. Boomers and our people at the end of South Sudan. That's what we will do.
So roughly, what is the total percentage of the people affected with HIV in South Sudan?
People living with the virus is 190,000. But that is not correct too. Because not everyone, we know stigma. And people, they don't declare themselves. We know that there are a lot of places where there is no services. So we are saying it's 190,000, but it's more than that.
Okay, Honorable, just some months back in Bor, the Minister of Health issued an order for men to be circumcised. That was raised as a matter of curbing the spread of infection.
Yes.
But we doubt whether that one can work, given the fact that the tradition there cannot allow circumcision. We don't know how effective is that. And in case, there are some people who don't want even to go for a checkup to see the status. So, what is your take on that?
You know, it's a collective work. People have to know that to take care of yourself, you have to prevent yourself from some diseases. And one of them is this HIV. Circumcision it protects you 60%, but not 100%. And we as South Sudan, as Dinkas, especially Dinka Bor, they don't circumcise. They will sing you bad and call you bad name when you are circumcised. But this is health issue. That's why we say, please, young people, go and circumcise. It will protect you 60%. Young kids, parents, take care of them, circumcise them, so it will protect them. That is, and you know, our people, they don't listen. But we hammer. You talk, maybe they will listen. And people like you, media, that is your job. And you are doing a great job too. Talk to them.
So are you encouraging the citizens to go for the circumcision?
Yes. I encourage them to go for circumcision.
Okay, just one last question on my side.
Yeah.
At some point, we are seeing alarm raised, like in Nimlu, at some point among underage. Sometimes I talk to the hospitals in Nimlu, were saying it is alarming among the younger age. But there was also an alarm on that, and that is the order of the minister. There are some areas like in Juba here. Do you have some areas that are free, areas that have more concentration, if you take the data that you have at hand?
We have in Juba here, Shirkat is really having a high. And you know Shirkat, when... Okay. Shirkat has a high infection because our people, they come from, and they see this beautiful light skin. There is something wrong with you, man, South Sudan. You like the light skin, okay? And now you make us, these our young girls, they are bleaching because of you. So you see this, and then you go, you don't even ask, where are they coming from? Are they okay? Okay? Then you mung with them. At the end, you get HIV. You take it home, where you came from. So that's why it is high in Yerul, because they sell their cows, they stay there, they take it home to their wives, to their, and the same thing to both. Yeah, so we have a problem.
Okay.
Yeah. Thank you. Thank you.